all you got to do is just look up a little bit. There you go. How was that?
Oh, that felt really good on this side.
Good. So in terms of your lower back, can you point again where you're feeling some of that pain?
So mostly it's my mid back between my shoulder blades.
And then, so it's right into this area here, or
yes.
a little bit lower?
Right here.
So more a little bit lower here, so just beneath the shoulder blades. Okay. All right, so that's been going on. And then you also mentioned the lower back. Where do you feel the lower back at?
So more towards like the lower part of my butt.
Okay.
Like I mentioned, I felt while skiing, so
okay.
I'm usually doing this.
Okay, gotcha. Yeah, and so you said that usually after, was it like a couple hours or a few hours, and then you feel like you can't really sit on it, you have to like lean off a little bit?
So I do have a stand-up desk just to try to, compensate. But, I want to say like 3-4 o'clock, I'm literally like sitting on the chair like this.
Just to ease up some of the pressure on the lower back?
Yeah.
Okay, gotcha. Okay. And then this happened fairly after the fall as well, right? The mid-back pain? Or is this something that's been longer?
That one's a little bit longer, but it just over, after I fell, it just kind of progressed after that.
Yeah. Okay. So let's take a look here. So you were skiing, you said, and then that's when you had fallen. Was it like you fell off of the skis, or was it the lift that you had? You said it was a conveyor belt, right?
No. So I was coming down. It was like a small hill, but people were already coming down the same path. So I tried to get off the path to go to a different one, and I just lost my balance and I just fell.
Oh no. Are you a pretty avid skier, or is that like your first time?
No, so I do snowboard, but that was the first time skiing, so it's a little harder.
I see. Really? You thought it was harder?
Yeah, I have no balance. Just trying to do it on two it's weird.
Yeah, I thought that snowboarding would be harder than skiing because your feet are stuck, but you're saying that you think that skiing's harder than snowboarding.
Yeah, because when you snowboard, you either just like flop over, but with skiing, it's like there's too many different ways you can go. Yeah,
no, around ski season or snow season, we tend to get a lot of patients in our office because they fall, and I always recommend people, no matter like what level, like if you're pretty good at like being active or not, like just taking some lessons can save you a lot of hurt.
Yeah, I obviously did.
Yeah. That's okay. So we got some stress right up on the top here. So here is C5, 6, 7.
Yeah, that one.
C5 right there, right? Yeah. Yeah. So right there?
Yeah.
Yeah, on that left
mostly.
side? Yeah. Like that. Okay. So it looks like we're going to be looking at C5 on that. 6, 5. 1, 2, 3, 4. Here's T5, 6, 5, 4. Any soreness on those ones?
Mostly 6.
Mostly on 6. We're going to go a little bit lower here. 6, 7, 9, and then here's 10, 11, 10, 9.
10.
More on 10 right there?
Yeah.
Yeah. Okay. Is that where you feel a lot of that?
Yeah,
that
mostly.
Right there? Yeah.
Sometimes I'll have my husband like squeeze me, and to be honest with you, it feels so
good.
So good, the relief. Yeah. But sometimes it wins me.
I see. Yeah. Well, I don't recommend that, obviously. It's not as specific as trying to figure out what's going on. I understand, like, in that situation, if you're just really needing something, people do what they do. But in terms of the actual problem, it's better to get a professional chiropractor to really find what's the actual problem and just adjusting that specific joint in itself. Real quick, here's S1, 2, and then 3.
Oh yeah, that one.
3 is a bit more.
Yeah.
Okay. Yeah, right there. Okay, that's your C5 right there. We're gonna get this going from the left here. And relax, and then bring your feet out in front of you just a little bit more. There you go, nice and relaxed here. So drop in there. As you let that shoulder relax, all you gotta do is just look up a little bit. There you go. How was that?
Oh, that felt really good on this side.
Good. Alright, same thing, just relax that shoulder for me. Get a little bit of a push right there. Let it go. Good. Good. Alright. You alright?
Yeah.
Good.
The wind up.
Go and just get some movement, bring those feet up. Alright. Good. So just with that, how are you feeling? Anything different?
Yeah, the left side feels like less
tense.
Yeah, less tense.
Less tight.
Yeah.
So T10's a pretty tiny guy here. So we're gonna see if I can get some good movement right there. Go and relax that belly here. Good. Good. Just breathing in for me. You let it go. It's gonna be a little bit of a push right there, okay? Again, breathing in. And as you breathe out, wiggle your toes for me. There it is. Good. Good. Yeah, that T6 is looking better, even if we didn't adjust the T6. So we might not have to do that. We might just stick to your T10.
Mm-hmm.
Good. Good. That's looking good. Wow. All right. So let's see how we're doing. Just sitting there, you doing okay?
Yes.
Okay, good. All right, so in terms of what we did, so in terms of the spine, the first one that we did was your C5 here. That's the one right down the middle here. It's a very small segment, so it's very important that we try to get as precise as possible, because it can be very easy that we go on to C6 or even C4, but if I'm not on that C5 where that irritation's at, then it's not going to help you very much, right? Same thing with that T10 right over here. Again, it's a very, very tiny segment, and so as much as we can, like we talked about, we want to try to be as precise as possible, because I can get on that T11 or even the T9, and if we miss that T10, it's not going to help you very much, okay? And then the last one that we did today was your sacrum. We will eventually need to work on that pelvis, but right now the biggest thing I want to try to do is get some pressure off of that tailbone, to see if we can get some relief on there, okay? So your job is, after we get out of here, as much as you're able to, whether it be at work, you know, like I said, you have a standing desk, one of the best things that we can do is just get some movement, whether it be just going side to side, back and forth, because the more movement we can have, the better it's going to be. Movement is key, okay? So whether you're doing movement at the desk, or if you have some time, go for a little bit of a walk around the office, whatever you can. The more movement that we have, the better, okay? The reason why is because now that we got movement in the joints, now the movement will actually help to push out some of the inflammation out of the joint. So the work has been done here, but the bulk of the work is going to be done out of the office, okay? So right now, that's all I need you to do is just get some walk and get some movement, and then we'll see how you're doing on your next visit, okay? All right, doing okay?
Thank you so much. Yeah,
good. You did good. So
Thank
proud of you. All right, well, let's get you going. Let's get you out of here, and you are all set. We will see you. When's your next visit? Monday? Tuesday?
Monday.
All right, good. All right, well, you're all set. We will see you next time, and until then, have a good weekend, okay?
You too.